Hello again, everyone, and welcome back to our next discussion, which covers the kidneys. So, today we're going to talk about the kidneys, why they're so important, what they do, etc. So, we have discussed before that the kidneys is kind of the emotion that we hold in our kidneys is fear, and if we are fearful for long enough, we will eventually create a little bit of an energy imbalance in our kidneys. But let's talk about the physical aspects of why are the kidneys so important. Most people know that the major function of the kidneys is to remove waste products and excess fluid, easy for me to say, excess fluid from the body. These waste products and excess fluids are removed through the urine. The production of urine involves highly complex steps of excretion and reabsorption. This process is necessary to maintain a stable balance of body chemicals. Excuse me for a minute. I think I need some water. I just fed my kidneys a little bit. The critical regulation of the body's salt, potassium, and acid content is performed by the kidneys. The kidneys also produce hormones that affect the function of other organs. For example, a hormone produced by the kidneys stimulates red blood cell production. Other hormones produced by the kidneys can help regulate blood pressure and control calcium metabolism. The kidneys are powerful chemical factories that perform the following functions. They remove waste products from the body, they remove drugs from the body, they balance the body's fluids, release hormones that regulate blood pressure, produce an active form of vitamin D that promotes strong, healthy bones, controls the production of red blood cells. The kidneys perform these life-sustaining jobs of filtering and returning to the bloodstream about 200 quarts of fluid every 24 hours. About 2 quarts are removed from the body in the form of urine, and about 198 quarts are recovered. The urine we excrete has been stored in the bladder from anywhere from 1 to 8 hours. There are many causes of chronic kidney disease. The kidneys may be affected by diseases such as diabetes and high blood pressure, and some kidney conditions are inherited, so they run in families. Others are congenital, that is, individuals may have been born with an abnormality that can affect their kidneys. The following are some of the most common types and causes of kidney damage. Diabetes is a disease in which your body does not make enough insulin or cannot use normal amounts of insulin properly. This results in a high blood sugar level, which can cause problems in many parts of the body, but diabetes is the leading cause of kidney disease. High blood pressure, also known as hypertension, is another common cause of kidney disease and other complications such as heart attacks and strokes. High blood pressure occurs when the force of blood against your artery walls increases. When high blood pressure is controlled, the risk of complications such as chronic kidney disease is decreased. Polycystic kidney disease is the most common inherited kidney disease. It is characterized by the formation of kidney cysts that enlarge over time and may cause serious kidney damage and even kidney failure. Kidney stones are very common, and when they pass, they may cause severe pain in your back and side. There are many possible causes of kidney stones, including an inherited disorder that causes too much calcium to be absorbed from foods and urinary tract infections or obstructions. Urinary tract infections occur when germs enter the urinary tract and cause symptoms such as pain or burning during urination and more frequent need to urinate. These infections most often affect the bladder, but they sometimes spread to the kidneys, and they may cause fever and pain in your back. Drugs and toxins can also cause kidney problems. Using large number of over-the-counter relievers for a long time may be harmful to your kidneys. Certain other medications, toxins, pesticides, and street drugs, such as heroin and crack, can also cause kidney damage. However, Early detection and treatment of chronic kidney disease are the keys to keeping kidney disease from progressing to kidney failure. Some simple tests can be done to detect early kidney disease. There are tests for the protein in the urine or a test for blood creatine. It is especially important that people who have an increased risk for chronic kidney disease have these tests. And you may have an increased risk for kidney disease if you are older, have diabetes, have high blood pressure, have a family member who has chronic kidney disease, are African American, Hispanic American, Asian, and Pacific Islander or American Indian. Kidney disease usually affects both kidneys. If the kidney's ability to filter the blood is seriously damaged by disease, waste and excess fluid may build up in the body. Although many forms of kidney disease do not produce symptoms until late in the course of the disease, there are 6 warning signs of kidney disease: high blood pressure, blood and or protein in the urine, a creatine and blood urea nitrogen, so BUN, blood test outside the normal range. So a BUN test outside the normal range. BUN and creatine are wastes that build up in your blood when your kidney function is reduced. And a GFR test less than 60. GFR is a measure of kidney function. More frequent urination, particularly at night, difficult or painful urination, and puffiness around eyes, swelling of hands and feet. These are all signs or warning signs for some kidney dysfunction. It's very important to seek a qualified practitioner to help you with supplementation for kidney health. There are a few health tips that can keep your kidneys healthy. So, one would be keeping active and fit. Regular exercise is good for more than just your waistline. It can lower the risk of chronic kidney disease. It can also reduce your blood pressure and boost your heart health, which are both important to prevent kidney damage. Walking, running, cycling, and even dancing are great for your health. Find an activity that keeps you busy and having fun. It's easy to stick to it if you're having fun, and then you'll have great results. Control your blood sugar. People with diabetes or a condition that causes high blood sugar may develop kidney damage. When your body cells can't use the glucose, the sugar, in your blood, your kidneys are forced to work extra hard to filter your blood. Over years of exertion, this can lead to life-threatening damage. However, if you control your blood sugar, you reduce the risk of damage. Also, if the damage is caught early, your doctor can take steps to reduce or prevent additional damage. Monitoring blood pressure. High blood pressure can cause kidney damage. If high blood pressure occurs with other health conditions like diabetes, heart disease, or high cholesterol, the impact on your body can be significant. Certain dietary, lifestyle, and nutrient modifications can support healthy blood pressure. Monitoring your weight and eating a healthy diet. People who are overweight or obese are at a risk for a number of health conditions that can damage their kidneys. These include diabetes, heart disease, kidney disease. A healthy diet that's low in sodium, processed meats, and other kidney damaging foods may help reduce the risk of kidney damage. Focus on eating fresh ingredients that are naturally low sodium, such as cauliflower, blueberries, fish, whole grains, vegetables, a lot of different things like that. Drink plenty of fluids. There's no magic behind the cliche advice to drink 8 glasses of water a day, but it's a good goal precisely because it encourages you to stay hydrated. Actually, the kind of rule of thumb that we use is that half your body weight in ounces is kind of how much water you should be consuming on a daily basis. Regular, consistent water intake is healthy for your kidneys. Water helps clear sodium and toxins from your kidneys. It also lowers your risk to chronic kidney disease. So aiming for at least 1.5 to 2 liters in a day. I would say probably more like 3 liters of water a day, but Exactly how much water you need depends largely on your health and lifestyle. Factors like climate, exercise, overall health, whether or not you're pregnant or breastfeeding. These are all important considerations when planning your daily water intake. And as I always say, the solution to pollution is dilution. So the more water you intake, that kind of helps your body filter out toxins and helps you eliminate. So water is like one of my favorite things. People who have previously had kidney stones should drink a lot more water to help prevent stone deposits in the future. Don't smoke. It seems like that one's kind of obvious, but smoking damages your body's blood vessels. This leads to slower blood flow throughout your body and to your kidneys. Smoking also puts your kidneys at an increased risk for cancer. If you stop smoking, your risk will drop. However, it will take many years to return the risk level of a person who's never to return to the risk level of a person who's never smoked. Be aware of the amount of OTC pills you take. OTC standing for over-the-counter pain medication, because these may be causing kidney damage. Non-steroidal anti-inflammatory drugs, NSAIDs, including ibuprofen and naproxen, can damage your kidneys if you take them regularly for chronic pain, headaches, or arthritis. People with no kidney issues who take the medicine occasionally are likely in the clear. However, if you use these medicines daily, you could be risking your kidney health with this pain. However, your kidney function tests have your kidney function tested if you're at a high risk. And if you use a lot of these over-the-counter medications on a daily basis, and have been doing so for quite a while, I would definitely suggest having a kidney function test done. If you are high risk for kidney damage or kidney disease, it is a good idea to get regular kidney functional tests. And the people who may benefit from regular screening are people who are over 60 years old. People who were born at a low birth weight, people who have cardiovascular disease or a family member with it, people who have a family history of high blood pressure, people who are obese, and people who believe that they may have kidney damage. A regular kidney function test is a great way to know your kidney's health and to check for possible changes. Getting ahead of any damage can help slow or prevent future damage. A little more than 1 in 10 Americans over the age of 70 show evidence of kidney disease. Some form of kidney disease are progressive, meaning the disease gets worse over time. When your kidneys can no longer remove waste from blood, they fail. Waste buildup in your body can cause serious problems and lead to death. To remedy this, your blood would have to be filtered artificially through dialysis, or you would need a kidney transplant. The takeaway is this: maintaining an active, health-conscious lifestyle is the best thing you can do to make sure your kidneys stay healthy. If you have a chronic health condition that increases your risk for kidney damage or kidney disease, you should always work closely with your health practitioner to watch for signs of loss of kidney function. Thank you so much for listening to this edition of Next Level Wholeness, where we discussed the kidneys and why you have them and what do they do. Thanks, and until next time, have a next level healthy day. Bye.